My name is Rachel Koba, and I serve as the Senior Technical Advisor for Adolescent Health with CARE International. I am based in Zimbabwe. For my Southern Africa Leadership Journey for 2025, my project is titled Strengthening Governance and Advocacy for Girl and Women-Led Community-Based Health Organizations. The Voices in Power. As a brief background to my project, in Zimbabwe, women are about 52% of the population, yet they only hold around a quarter of senior public leadership posts. It is also important to acknowledge that when it comes to community health, most of the work being done in the community are being led by women who are frontline health workers or women-led community-based organizations. However, they face governance deficits, which include weak board structures, unclear leadership roles, and limited formal governance training. This also speaks to the gap in terms of local leadership, hence suggesting that community-based organizations that are women-led are struggling to engage meaningfully in advocacy and policy issues that actually affect them personally. Because of our societal norms and culture, women and girls tend to not attain the highest education. Hence, this then also means there's limited training, suggesting a gap in terms of their leadership skills and advancement when it comes to advocacy capacity. We have also seen a shrink in terms of the civic space, mainly because of the private voluntary organization, which was, organization bill, which was recently reviewed, making it hard for community-based organizations to operate effectively. The project, therefore, is a peer-centered leadership and institutional strengthening governance initiative, which is focusing on improving governance, legal requirements, and advocacy capacity among startup, girl and women-led community-based organizations that are within the health space. Why? Because we do find that locally based girl or women-led community-based organizations are trusted within their community. They have first knowledge and experience when it comes to shaping health issues that affect them. They also have that last mile reach where they reach populations that are usually underserved. They are also culturally relevant and context so that the projects fit into the culture, and they are more sustainable and scalable. So through participatory training, mentorship, and advocacy roadmap co-creation, this initiative actually supports leadership, growth, influencing, and visibility amongst women and girl-led community-based health organizations. Their voices are elevated, and therefore this makes the health project responsive to their needs. There will be development of relevant capacity strengthening tools, which will help the governance, influencing, and advocacy for these community-based organizations, and leveraging on stakeholders which are already in existence in order to identify community-based organizations that will need this training. And at the end of it, creating a network for support amongst the community-based organizations. To date, I have managed to partner 2 local NGOs within Zimbabwe, where I've rolled out the training to 45 women serving community-based organizations across 10 districts. And this also included developing a governance and advocacy training curriculum. Currently, I'm working with the government structures within these communities to ensure that the 45 women-led and girl-led community-based organizations are registered to meet the legal requirements of the Private Voluntary Organizations Bill. And I'm also currently seeking other partners within the feminist networks and the private sector. However, the bill continues to present challenges because most of these community-based organizations are underfunded and they will not be able to meet the requirements of the bill. Lastly, the project has also embraced the 4 leadership pillars, which are authentic, inclusive leadership, strategic leadership, and impactful leadership. By being grounded in lived experience and purpose, creating space for diverse voices, shifting systems not just a project, and measuring change in voice and visibility. In conclusion, through this project, Voices in Power, I am not just raising voices, I am building the systems that will sustain them. I thank you.